The Agenda is powered by DART, Delaware's transit service, moving forward.
Hello, Kerwin Gaines here. Welcome to The Agenda. This season, as I've been telling you time and time again, is going great. It's going so well, we have guests that are actually coming back within the season, so we must be doing something right. And they're Republicans. Go figure. Yes, the Republicans do like us too. And that's none other than Mike Ramone and Jeff Hilovsky from Long Neck and Pike Creek and their districts. Thank you so much for coming in. But I will say that every time that you all come, the issues are at the forefront for Delawareans. So thank you. Thank you for that. I love to see when things in Dover are moving, forget partisanship. It's all about Delawareans, and you two have exemplified that. So thank you so much for that work down in Dover. You all know me well enough to know that it's legitimate when I'm telling you.
Yes, sir.
And you have another big issue that you're on the show today to talk about, and that is healthcare.
Healthcare indeed. Mm-hmm.
But let's be honest, we're not saying that other states aren't important. We're not saying that other people aren't important, but this is particular for Delawareans, right? And the health of Delawareans and the cost of health for Delawareans. And as someone who has to go to Walgreens every 3 weeks or whatever and pick up my prescriptions, I have noticed that the costs are going up.
Mm-hmm.
A family of 5, the cost is going up, right? I noticed those numbers, and I am insured, thank you, Lord. But I can only imagine for those that are not. I can only imagine for those that have chronic issues that take them. And one of the chronic issues, I would say, is diabetes here in the state of Delaware. It's obesity. It's so many common things that we just take for granted. And the governor has made it very clear that the cost of healthcare is just unsustainable. It's just unsustainable, and it can't happen. You all have an idea, I think that's fair to say, an idea that you would like to bring forth that could help all Delawareans, that could help everyone in regards to healthcare cost.
Agreed. I would suggest if we could accomplish 10% of what we've been told by this initiative, it will be astounding. Unfortunately, Delaware is one of the least healthy states in the nation. Quite frankly, happened to be a guy who's been a fitness guy my whole life.
I did not know we were one of the, I've been on the show that we've talked about our kids are at the bottom of the rung when it comes to education. We're
Mm-hmm.
part of the top 5 of schools that are not succeeding. Mm-hmm. Now you're telling me that we're at the bottom of the rung in regards to health?
Well, and please understand, we are definitely an import senior state.
Mm-hmm.
Many elder persons have moved into our state with the with some of the modifications and the cost of some of the real estate for the last 5-10 years. I know it's gone up a lot, but the reality is simple. Healthcare should reflect keeping people healthy. And I'm not quite sure we focus on that enough in our state. Mm-hmm. We have, I would suggest, a runaway unintended overt expense just in the state of Delaware for our retirees in the billions of dollars, and it's getting larger and larger each year of the amount of money that we take in versus the amount of money it costs to keep our retirees healthy. We just had an attempt to attack that and raise that price on all the retirees, and we were very fortunate to avert that. Next, now we're writing bills that's controlling what hospitals can do with their cost and how they charge. We're not saying everybody who goes into a hospital's emergency room still must be cared for, even if they don't have coverage, but we're saying we're going to look at their books if they're not, if they're making too much. These kind of things in Dover are not problem resolution environments. Mm-hmm. They're Band-Aids. Mm-hmm. I'm not going to get into education, but we got so many Band-Aids for education. When we finally peel them off, we're going to see that patient's septic. But in healthcare, it's also an issue. The numbers, it's 37 90% of the people in Delaware on Medicaid. And there's a lot of health issues that you just can't do much about once they come. But one you can is obesity and diabetes. And Dr. Jeff came in, I was in leadership the last few years, and when Jeff got elected, he was just so focused on solving some very specific problems, financial literacy for our children, and diabetes and healthcare. So we talked, and he took off. When you give him a bone, you're not going to get it back. And it's just amazing. And I'll let him describe the process we went through to try to set up a test project in the state that will save the state more money than it will cost to do the project, and could be stunning in the future, not just saving the state money, but making our state a healthier place to be. And that's one of the things we're supposed to be doing. Not one party, the other party, but Delaware. We're all Delawareans. We're all the blue and yellow. And I think Jeff's hitting another home run, and I look forward to, as a leader, doing everything I can to help him. And if I ever have a little bit more aggressive position in the state that I can even do more, I plan on prioritizing this.
You should run for governor.
You think that'd be a good idea?
I think it might be.
Thank you, sir.
So I was like a person in a circular room being told to stand in a corner when I came up with this idea. So I sought Mike's help because I knew that he could give me the direction I needed to push this forward. And here's what we know. SeniorLiving.org says that we are 49th out of 50 in healthcare.
For seniors.
For seniors, 49th out of 50. We spend 39% more on medicine costs than the average state does. 39% more. That's stunning. We have, we're 44th in healthcare costs. We're 40th in healthcare access, and we're 41st in outcomes. So who wants to be that when there are only 50 states? So we're in the bottom 20% of everything, and when you add those three up, we place so low that we're now 49th. So something has to be done.
But we're a state that I guess says that we're great at technology, and we bring technology in here. We're the home of DuPont. We're the home of all these other things. Not saying that those companies have a responsibility for the healthcare, but we lived a long time with AstraZeneca and all these other great companies here in the state. Why are we so daggone low? I'm just getting sick of not scoring well when there's no excuse not to.
And I may suggest that we're so low because it hasn't been prioritized and recognized as an issue. It's easy for people who don't have the issue to not recognize it. But if you have obesity in your family, or you have a relative who lost a foot or a leg, or for a diabetic lack of flow to certain limbs, and you see what it does, if you have a fitness center where you have children who swim every day and you see how it affects their ability to do well in school and to be focused and stay in shape and get off the technology, you determined that you need to fix this. But Jeff came to the table mainly because he saw the incredible stress on our budget and what we tried to do to the retirees and what we're now doing to the hospitals, and felt there needs to be another way to solve this problem. Let's move to the front of the table rather than reacting to everything at the back of the table, and that's where he is. And I mean, after you look at all these numbers, you say they're bad, and it's unsustainable in the budget we currently have. We cannot continue to have these runaway costs, and it's something we can fix.
Right.
So we have 28% of Delawareans are either diabetic or pre-diabetic. 37% of Delawareans are obese. Obesity and diabetes go hand in hand like brother and sister, and that's the bad news. And so the solution for this is when the governor said, look, our costs are unsustainable. He said that twice in the first 10 minutes of his budget address. So I thought, well, maybe there's something that could be done. So I start looking for a technology solution, and I presented a few options with Mike. We had a spreadsheet, and we looked at it and vetted a bunch of companies. And I said, I think this one I like this one because of what they do. They have a combination of some genetic testing, which would be, firewall protected, so to not get out, whatever, privacy, and then they have a series of blood tests that will determine metabolic fitness, metabolic health, because what we're talking about is diabetes as a keystone disease for metabolic syndrome, which includes hypertension, heart disease, kidney disease, liver disease, even Alzheimer's. Mayo Clinic says Alzheimer's is diabetes type 3. So when you put all that together and say, all right, how can we help? Well, now when we have a company doing this and they say, oh, guess what? Here's what we're going to do. We're going to team up with the family physicians in the communities, and we're going to use our AI, artificial intelligence, to generate, here's where you are, here's what we know you can be based on your genetics. And if we can influence this part a little bit, then the genetics can be as little as 10% of an influence on how your health ends up. So if we can focus on the metrics and improve those through individualized, specialized, Kerwin's different from Jeff, Jeff's different from Mike, Mike's different from Kerwin, so we all have our own individual plan, and if we even follow that a little bit and drop the costs at $1.1 billion, it's possible, maybe not direct correlation, but if we move the needle 5%, that's $55 million in savings. But the most important part is it will give people back their life. They will feel better. They will have more energy. They will want to participate in their children, grandchildren, and whatever, in their family events and in their community events. And so what we're trying to do is change the paradigm to make sure that healthcare is something that is respected as something to take care of versus react to. So I have a tummy ache, I go to the doctor, it gives me something for my tummy ache. Well, what if that was metabolic syndrome and we could prevent that before I ever have a tummy ache? Then the savings are immense, not only in cost, but that improves access to care. Everything.
How soon can we see these savings? Is this something that's generational, where then, well, in 10 years from now, we'll see savings, or, the next generation will see savings? Or is this something that's like, we'll see this right away?
I perceive, doing the math and looking at the numbers as a business person, it's going to be instantaneous. It will. Immediately when you start getting the results, first of all, when you start seeing the results and you educate people, A plus B is going to equal C. If you don't care about C, being in a wheelchair and all that, then that's fine. A and B are fine. If you do, we need to modify A and B. You have productivity enhancement that's going to be better as this happens. It isn't you have diabetes and then you don't, right? We know that. But there is a path from A to Z. And doing that path, it's not when you get to Z, you feel better. It's every day you're moving to Z, you feel better. Every day you're moving to Z, your care, your need for hospitalization or doctor's appointments, your body's ability to get sick easier because you're not as strong to fight off disease, your ability to help the next generation learn that they don't get heavy and then have to get ill. So you change a whole generation of thinking of healthcare as opposed to sick care, treating people when they're sick. That's always been a really popular thing for politicians. Let's talk about healthcare, not sick care. Well, let's do something about it. And that means we need to talk to insurance companies. We need to talk to pharmaceutical companies. We need to create an environment that gets us to healthy awareness of what we put in our body, how we exercise our body, and what we subject our body to will help us maintain a healthy body and health care as opposed to sick care. It's instant. At the point that people start this behavior modification, I believe it will be instantly realized. The people we're dealing with, the different groups, there's segments, the hospital, the third party, the state employees as a group, potentially the universities, they all suggest that as this improvement continues, it's almost like Pavlov's dog. It's positive enforcement gives more positive enforcement. So they're going to see, oh, this is better. We have watches now we can wear, Kerwin, and it's going to tell us. You get instant gratification. Oh, I did better. I got my steps in. So dovetailing this technology with one of the first full-scale initiatives to digest healthy living lifestyles through education, not requiring but educating and motivating people to want to do the right thing and teaching them how, and letting them instantly see through these tests and potential some sort of a mechanism you're wearing is staggering. This is a very competitive country. It's a very competitive state. This is people competing with their own selves to be better and healthier. Your children's brains will work better when they're in school because they're healthier and they're fired up and everything's working right. People will be more productive at work. They're going to come up with more thinking ideas. They're going to be coming up to be able to not call out of work as often. This is instantly realized within less than a year, in my opinion.
So tell us a little bit, tell the viewers, how are you selling this idea? And I hate to say sales, you guys aren't salespeople, you're legislators.
We're salespeople. We know, we get it.
But you have to convince. It isn't as like these two representatives have this great idea and it makes sense and it just becomes law, legislation. There's a process that you have to do. There's studies that have to be done. What have you done thus far, and what roadblocks have you encountered, if any?
So, well, we know the facts are on our side, very much so, because we know that a person, for example, a person without diabetes goes to the emergency room and it's a $1,000 bill. Statistics tell us, and the cost analysis tells us that if that same person goes to the emergency room, that visit will be 2.3 times more expensive. Their health care is so that $1,000 turns into $2,300 without even sneezing. So the roadblocks that we've had is just getting in front of people and say, can we drop all preconceived notions, because this is different. Oh, it's not different, because we've had diabetic programs that all fail. They're nasty. Nobody wants to do it. They do it for a week, and it's like a gym membership in January. By March, only the very dedicated. So what we've done is say, look, the technology is solid. The information is there. They have 100,000 lives that they've tracked over 14 years of doing this. So this is not new science, but it's improving science. And with every day and every metric that they change to say, this is something we've found out, now that we've reached this critical mass with this amount of data, we can move forward and we can interpret, then we turn on the AI part of this and we can make predictions. So there will be a time that this is not too far off in the future, that first of all, food is medicine. And I was saying that when I was practicing, because I saw diabetes. I said, well, look, you go to the gas station and you have two pumps. One says gas with water and gas. Which one are you going to put into your $40,000 car? Well, the gas. Well, why don't you put in the gas with water? Because it will mess up my car. But you put food with nasty stuff in your body all the time, and you don't think anything about it. And so we have to change the thinking a little bit, and this allows people the opportunity to understand based on facts. If you go to dinner with your wife, and let's say you're pre-diabetic or I'm pre-diabetic, whatever, and man, I'd really like some of my wife's cake. She's not diabetic, and I want some for dessert. So you take your phone and you put up your continuous glucose monitor. It says blood sugar 92. Honey, you can have a couple pieces of that cake. But if it says 140, you're going to say, I can't do that, because you know that.
You're making
but
a better
right now,
decision.
we don't know that, because you say, I want the cake, I'm going to have the cake, doggone it. But the metrics and how we change this and how AI is going to interact with that is going to change the game for people who are willing. And then when you get the people who are willing, that are feeling better, they're going to tell their neighbors and their friends, and they're going to tell their family members, how'd you lose 30 pounds? Well, you're not going to believe this, but I'm on this crazy program through the state insurance, and because these two guys thought about it, and then they got a whole team of people in it, and they've got a technology company, and it's working. So I think that I agree with Mike that we're going to have near instantaneous results of some sort. It's going to be positive. But I think that over time, this is going to be tectonic. It is going to change our life. And Delaware's the perfect state. And this is how I sold it to the company when we called them. We said, think about this. Delaware has 1 million people. And
It's a good model, right?
Great model.
Easy math.
So now if you can roll this out to Nebraska, to Pennsylvania, to New York, to Florida, all we need is cooperation and diligence on your part, and then we get human services to jump in human resources to jump in on this with excitement. Then we can get that ball rolling. And that's what House Resolution 32 that Mike and I sponsored is meant to do. It's to partner with the health resources people, and it's to partner with a local medical service.
Have we
system.
Identified that yet? Those local medical services?
Well, right now it's BB, but we're open to more. It's just BB because honestly, I live in Sussex County, and Mike was busy doing leadership stuff, so I just went to the local hospital, knocked on the door, and said, "Can we have a talk?" And then Mike jumped in on Zoom, and so the three of us had that conversation. We've had multiple conversations since then. They are focused on this as well because they see that this is a way to improve access, improve outcomes. 41% worst in we're number 41 in outcomes.
That
that's
blows
stunning.
my mind.
That's stunning.
But let me suggest the competitive advantage we have. Jeff just hit the home run. Is the size of our state. When you have a public, private, and you have the government, a private business sector, the hospitals, maybe the universities, able to focus on a project and be able to create a test sector that the company that is involved in it, the private sector company, is clearly able to say, look, this is going to save you more than it's going to cost you. We are going to save you so much more. If we're going to charge you $1,000 a person for 1,000 people in a test group, we will save you more than that within 2 years. And I believe that could be true, not just from their traditional services and care they need. I'm not even counting their actual cost in the medical environment, but their ability to be at work more often. They're state employees. They're going to be there more often. They're going to feel better when they're there. Their productivity when they're there is going to be enhanced. Here's what you need to do. You build the right team. That's what's going on now. Are we saying this one's in, that one's out? No, we're saying Jeff went to BB. They were already working on something like this. They already had a gig.
We're just at the test phase right now.
No, we're really developing the team. Once the team's developed, then we go into test phase. And in order to justify that, you need to educate the public. You need to have a clear path forward, and you need to create an engaging team that is cohesive and working together and not pulling things apart. That's the place we're at right now, trying to finalize that team. Next is then you get the study group, which we think we have already identified. Then you get the funding, which is the next thing we need to do in the government. And I believe funding anything that saves more than it costs in the state of Delaware should be something that is aggressively supported, which I hope to do. And then you begin implementation. I believe we will be through that by the time we have a new governor in January. We'll start putting the pieces together, and hopefully by March, we will be seeing something that's making Delaware healthier again.
You mentioned a number, and I don't know if we gave it justice, but $1.1 billion. $1.1 billion is the cost of health care
in 1 year, in 2022.
2022, that's directly related to diabetes.
Solely related.
Solely related
yes.
to diabetes.
So that's not counting lack of productivity in the marketplace. That's not counting days off at work. That's not counting so many other things. That's just direct cost right now to care for sickness, not to create health, but to care for sickness of a preventable disease.
So from a business standpoint,
how much are we spending on education?
We spent 36% of our budget on education.
2 point something billion.
Yeah.
So half of the cost of education in the state of Delaware, in theory, is the same amount that we're using to treat diabetes.
Yes.
Just diabetes.
Just one
diabetes.
disease.
Just diabetes.
You got it.
Yeah. Now
So-
that's all costs. That's all the insurances plus private pay. So that's every cost. It's over $800 million in direct cost of diabetes, and then
240 million in support costs like needles and test strips and diabetic hose and diabetic shoes and all that thing.
But none of that includes productivity costs,
Correct.
because you're losing productivity and you're missing work, and I would say not productivity costs, productivity lost. We're losing the productivity of our we're technically talking about the state of Delaware workforce. As this grows, I'm believing this is the entire state of Delaware's opportunity that we can make our state healthy.
In the last 60 seconds, how can Delawareans educate themselves on this matter?
Well, Mike and I wrote an article that's been published everywhere. It was in the Delaware Business Times a week or 10 days ago. So that's online everywhere, and all the News Journal, and
We'll post it.
And engaging, watching such great shows that some really brilliant people decide to let us talk on. That's always a good way to go.
Hey,
I'm running for governor. Didn't you say that?
we love that you're here. You guys always bring great ideas. And please tell the rest of your party. Come on, have a great conversation.
We got you.
We look forward to see how this goes. I want to be honest with you. From what you've told me, and I'm sure there's more than one side to every story, but from what you're telling me, it sounds like you have a very compelling argument here, and it's at least worth the study. So for those in Dover that are having questions about whether or not moving forward on this, we definitely support it here moving forward. So we hope that helps out a little bit.
And we truly haven't heard any pushback of implementation. It's just getting the how and the inclusivity, and that's what we're ironing out still, to get it right with the right team right out of the gates, so there's no stoppers once we get going.
And they will get going, and unfortunately we have to get going. We're so excited that they came on today, and Mr. Hilovsky, Mr. Ramone, thank you so much again for coming on to the agenda.
Appreciate it.
And they're trying to make sure that you as Delawareans stay healthy, that you're controlling your sugar, and that you're making wise decisions, and they're going to give you the data in order to do that. We're going to talk about, I wish we could talk about more of this, but unfortunately we can't. Look forward to seeing you next week right here on the agenda. We'll have some more hot guests for you. And until then, be healthy, Delaware.